We now know that opioid use disorder, substance use disorder, is a medical issue. It's not just, some people might think, a willpower issue or a discipline issue. It is a medical issue.
I work at a continuation school, so I see a lot of 16, 17, 18-year-olds. I've seen all ethnicities come into our office from different socioeconomic classes, and so it's really prevalent in our community, and it doesn't matter what your background is.
But the reality is that we want to help people treat themselves, just like as people equate it to a diabetes or high blood pressure or coronary artery disease. So with it being a medical issue, we have medication that can help with that.
We provide them with the support, both from a medication perspective, but also from psychology, nursing, social work perspective, a lot of tender love and care here in our system to get them through that initial withdrawal and safely start them on the right dose of medication so that they can then go on in their recovery.
We want to really treat the whole patient. So if there's a mental health challenge, we will connect someone to a psychiatrist or to a mental health provider. If they need a primary care doctor, we can do that as well. There's a counseling component. There is the nurses that they can talk to. It's a whole person approach to this. So we aren't only treating substance use disorder or opiate use disorder.
Our program inside the hospital is just one part of the larger system of care that young people with opioid use disorder can participate in Santa Clara County. So the way I like to think of our role is we are the ones that get you started on medication. The medication that we start you on is called buprenorphine, and it's the only medication that is approved for adolescents for opioid use disorder, but it is incredibly effective medication to help people in their recovery.
The clinicians offer person-centered substance use treatment services. We offer both individual therapy and group therapy on a weekly basis. We have access to medication-assisted treatment physicians. They could also go to the residential treatment if needed. We could always send them to the inpatient unit over at Valley Medical Center.
We use this evidence-based practice, which is called motivational interviewing a lot. So I, use that, and I was like, what's something that's stopping you, and do you think there's any way in which therapy would benefit you? And just by making him feel comfortable, taking the stigma and taboo out of it, that hey, don't worry, even though you're seeing me, no one's going to know what we're talking about, and there's no shame associated with it, right? It's just a form of self-care.
Our typical patient has sort of accidentally come to fentanyl, but quickly has gotten addicted to it and then is stuck in a cycle because of their fear of withdrawal. And that's kind of where we come in. We stop the withdrawal process with medication and get people stable on this medication that prevents withdrawal, prevents cravings for opioids, but isn't deadly. You can't overdose on it, and is incredibly safe. And so it's this amazing tool that we have to allow people to get their lives back.